All right, whether you're looking for specialty care or basic hospital surgery, look no further than Minnesota for the best in the nation.
U.S. News and World Report puts the Mayo Clinic at the top of this year's honor roll. It is the second year in a row for the Rochester-based hospital. Mayo is followed by the Cleveland Clinic and Johns Hopkins. The magazine looks at more than 5,000 medical facilities in the country to do its annual ranking. But a fight in southeastern Minnesota is targeting Mayo Clinic and its plans to move some services miles away. Starting in October, some care from Mayo Clinic Health System Albert Lea will move to the Austin Hospital more than 20 miles away. As WCCO's Liz Collin found, the plans have a city scrambling to keep its hospital operating the way it is.
In the city of 17,000, many consider the surprise summer announcement a medical emergency of its own.
We're all blindsided by it.
No city council or county commission vote, only a plan from Mayo to move intensive care, labor and delivery, and inpatient surgery to the hospital a half-hour east in Austin.
Here's an egg. We're going to take the egg yolk and all the contents, and we're going to give you the eggshell.
A group called Save Our Hospital now meets weekly to push back. Mayo Clinic says 500 patients visit the Albert Lea Hospital every day for things like doctor visits, dialysis, and cancer care. That won't change. It will for about 7 patients per day. But with a severe staffing shortage and a decline in hospitalizations, Mayo says it has no choice. The Minnesota Rural Health Association points out what's happening here is playing out across the country.
In the last 7 years, 80 critical access hospitals have closed in rural areas. 78 remain open in Minnesota right now, but they're all considered under stress, simply because the model and the money doesn't work anymore.
Healthcare experts blame Medicaid and Medicare cuts for the dwindling number of rural caregivers. Still, Joel Erickson says even smaller Minnesota cities have made it work.
We don't really accept that explanation. It just doesn't make sense to us.
As he moves forward with life-saving efforts at his local hospital. Liz Collin, WCCO 4 News.
On Thursday, the Save Our Hospital group will board buses and rally outside Mayo buildings in Rochester. Organizers told us that they're also exploring trying to find a new medical provider if Mayo doesn't reverse its decision to move its services.